Everybody, it's Dr. Eric Balcavage. We're back for another edition of Thyroid Thursday, and today we're answering another listener question. If you've got questions, definitely send them to me, either Instagram or at my main website, rejuvegencenter.com. We'll try and get those questions answered either in a podcast, a Thyroid Thursday video, or a short IG video. So somebody asked, can you treat hypothyroidism naturally? It's a great question. And I think we have to clarify a couple things. I'm not sure what this person meant by treat. Do they mean manage their thyroid condition with some type of natural product? Or are they trying to recover or eliminate the hypothyroidism to begin with? Can you naturally recover from a hypothyroid condition? And I would say the answer to both of these is potentially yes. So if the goal of this person is to try and manage their thyroid physiology or manage their hypothyroid condition, their labs, some of their signs and symptoms, are there natural products that you could use that don't require a prescription to try and manage the condition? I would say there are. There's definitely glandular products that are out on the market that might help you manage a condition. There's some controversy surrounding them, but this is where kind of things started, is initially with glandular products. So could you manage it with a more natural product? The answer would be you possibly could. If your hypothyroidism was caused by iodine deficiency and you just put more iodine in the system and that was the only issue, then you could probably manage or correct your condition. So the other part is, can you recover or eliminate a thyroid condition with natural methods? Well, I think that's really the focus of what we do in functional medicine, is to try and help somebody by changing their diet, their lifestyle, reduce the stressors, the triggers that initiated the hypothyroid condition to begin with. So I think you might need some medication through that process. And what I often see is that people are over-medicated. Once we start working with them to improve the causes, the triggers, the load that triggered this whole kind of hypothyroid process to begin with, they need less and less medication. And we see people many times not need medication at all, which means if they needed medication previously, maybe they needed 88 micrograms of T4, and over time, that dose continues to go down and dose continues to go down. What does that tell us? That tells us that the thyroid gland is actually starting to recover, starting to generate and produce more thyroid hormone. So a thyroid gland can recover given enough time and addressing the thing that caused the thyroiditis or the thyroid damage to begin with. So if you're trying to recover or eliminate the condition, then what you have to do is to consider what is driving your load, what's driving your hypothyroid condition. In allopathic medicine, many times we think about what's the condition, hypothyroidism. Here's the treatment for the condition. That's really not what functional medicine does, and that's not what helps somebody actually recover from a condition. What we should be doing in functional medicine is saying, why is the body behaving and acting like this, and what's causing it? And if we can reduce or eliminate the thing that's causing the body to respond in a certain way, that's how we help somebody heal and recover. And many times it has to do with diet, it has to do with lifestyle, it has to do with emotional and trauma, it has to do with physical fitness, too much, too little. And those are the things Dr. Kelly and I talk about in the Thyroid Debacle. All the things in the third part of the book are all the things to work on, all the lifestyle factors and what we call fitness factors that either cause us to be healthy or cause us to be ill, okay? So what's the thing, what's the load? You have to identify it, you have to reduce or eliminate, and then you have to support the recovery of the tissues. The big difference many times between what an allopathic physician is doing and what we should be doing in functional medicine is the allopathic physician isn't trying to identify what caused it. They're just saying, hey, this is the condition and this is what we're going to treat and manage, okay? In functional medicine, we're trying to say, that's the condition that you develop, but let's figure out why and address the why. And that's why many times we're able to have our patients actually recover versus just manage a condition. Fourth thing is, what are you willing to change? So if you want to get well, if you want to be healthier than you are today, you can't keep doing the same things today, tomorrow, the next day that got you into this situation to begin with. So you have to be willing to change something about your diet, something about your lifestyle, something about your sleep habits and patterns, something about your breathing, something about your environment. There's something going on that created who you are today. And so something's got to change. Many times people will come and we'll talk about the diet, like, I eat a clean diet, I do everything right. And they're like, it has to be something that I don't have any responsibility for. And maybe it is, but many times what they're doing, even though it seems healthy, isn't appropriate for them in that moment. Even for me, when I found out I had Hashimoto's, I was exercising, but I was exercising a lot, and then I wasn't sleeping well or breathing well, and that was resulting in this chronic stress response, the development of Hashimoto's, my Raynaud's to develop, and the only way to start to get healthy, and to repair, was to change some of these habits and behaviors that I thought were healthy that really weren't healthy, okay? And then the last thing is, what type of help are you open to? So if you want to restore your health, restore thyroid function and physiology, you actually want to recover, and you're going to a GP who this isn't what they do, you're asking them to do something they're not trained to do. You're asking them to help recover. They're going to tell you your thyroid gland can't recover. You just take medication. That's the way it is. There's nothing we can do except manage the condition. So you have to make sure that, depending on what your goal is, that you're asking the right professional to help you. If you want to recover and eliminate your condition, then you're willing to change things in your diet, your lifestyle, and you want to dig to trying to figure out what's causing your condition, then you're probably looking along the lines of a functional medicine practitioner, somebody who practices that style of medicine. And just because somebody hangs a shingle that says functional medicine doesn't mean they actually practice what I would consider the philosophy of functional medicine. Allopathic medicine's goal is to manage or treat conditions with surgery or medication. And that works for a lot of people. But functional medicine shouldn't be managing conditions and treating symptoms with lots and lots of supplements for the rest of your life. Functional medicine at its core should be looking at chemistry, looking at labs, looking at signs and symptoms, looking at your health history and timeline, saying, all right, what are the likely causes of this excessive load that caused the body to be behaving the way it is, and how do I reduce that load, eliminate some of those things, and support recovery? And yes, that means we may use some supplementation strategies, but if you need 20 or 30 or 40 supplements for the rest of your life, then I don't think you really got a functional medicine approach. Supplementation should be a supplement to a really healthy diet, lifestyle, habits, behaviors, etc. And so that it can be used short term to support certain stressors or weaknesses at certain points in time. There are some supplements that have been really shown to be beneficial for us as we age. But if you're taking more than 4, 5, 6 supplements from a maintenance standpoint, you're probably missing something. All right. So if you have any questions, put them below wherever you watch this video. And again, you might be able to get your questions answered on one of these Thyroid Thursdays or on a future episode of the Thyroid Answers podcast. Take care.